This is Doug Brunk for Global Medical News Network, reporting from the annual scientific sessions of the American Diabetes Association in San Diego. In 2005, most patients with type 2 diabetes likely had a prescription for rosiglitazone or pioglitazone in their medicine cabinet. But after 2007, prescribing patterns began to change in favor of novel 2-type diabetes drugs, according to a study conducted at the Joslin Diabetes Center in Boston.
Our principal aim was to see how we could use an electronic health record to go beyond serving as a data repository. What we wanted to do was we wanted to evaluate healthcare delivery at our institution, which is a novel area for the use of EHRs generally. What we did in this particular study was we took a question that had been addressed in using other databases, that is the use of a medication that had been taken off of the market, to see how our prescribers, our providers, responded to that FDA warning, as well as looking at the uptake of new medications that were introduced to the market during that time. What we found was that the medications that had been introduced to the market were taken up rapidly, and at the same time a medication which had a safety warning put against it was prescribed much less frequently over the 10-year period that we studied. Again, this excluded the use of insulin. So generally I think using any type of database, and in our instance the EHR, requires a lot of data validation and analysis to get to the influences of these health outcomes. Specifically at the question that we looked at, we need to look more broadly at the use of all diabetes medications, not just new medications that were introduced over the last decade and this class of medications called TZDs. So more specifically, we want to look at all diabetes medications to see how they've been used over the last 10 years and to see how that relates to our patients' health outcomes.